I am Phua from Center of Balance Fertility Acupuncturist. Just checking all the platforms on live now. Yep, it's all on live now. Now, good morning. Hi, Eric. How are you? Good morning. Good morning. Thank you for being here with me. Hi, everyone. I'm Phua from Center of Balance Fertility Acupuncturist. So if you're here now, please give me a thumbs up and say hello to me. Hi, Veronica. I'm good, thank you. And give me a thumbs up as well and share this live video to your social media if you're on Facebook and Instagram. If you're on YouTube, please say hi to me as well and give me a thumbs up. And when we finish this live video, please take the YouTube link, video link to post it on your Facebook and your social media. Thank you very much. Now, today our topic is actually we're going to talk about PCOS common symptoms, polycystic ovaries symptoms, common symptom. Right? It's funny, isn't it? So when we talk about PCOS, we see they have a lot of symptoms, right? But what are the common ones? Okay, the common symptoms. It's a bunch of them, right? I want to say that some women start seeing this following symptoms around the time of their first period, okay? Because some of the symptoms are very similar to, PCOS. The S means symptom, right? All the symptoms, it can be just a lot. It's just a normal symptoms, like not just PCOS. You don't have to be diagnosed with PCOS to get those symptoms. You see, like heavy period. A lot of people have heavy period, but they don't have PCOS. They don't have polycystic ovaries, right? And acne, gain weight. A lot of people gain weight or they have acne, skin problem, and they not necessarily suffer from polycystic ovaries, right? And some others only discover they have PCOS after they have gained a lot of weight. So gain weight is the main thing for PCOS. Or they have had trouble getting pregnant. They had trouble getting pregnant, and then they start having a lot of symptoms. Yeah. And I want to make clear something that in here is when we're talking about PCOS, there's a bunch of symptoms, but these symptoms, when you have all these symptoms, it doesn't mean you have polycystic ovaries. Let's say some people get irregular period, skip the period. Well, it seems like, PCOS, right? And they have gain weight, they have hair growth, heavy period, all this thing, or seems like PCOS, common symptoms. But when they have a skin, and all is fine, no cyst in it. So you can tell by the symptoms. But generally, it is PCOS. But I've seen some patients, they have tested, they have skin. Unfortunately, it's just hormone out of balance, but they have no cyst in the ovaries. Does it make sense to you? If you see fertility patients, you will see some of them, right? Then there are people that they don't, women that don't have any um, symptoms, period regular every month, period lasts for 4 or 5 days, no excessive hair growth, no acne in the face, they are pretty slim because they exercise every day, eat very healthy, they get their period every month, but when can't find they found that they can't get pregnant easily and they get a scan and they've been diagnosed PCO. They have polycystic ovary, and that happened. That really happened. I've seen this in my clinic. Hi Hassan, how are you? So I want to share with you that in my own experience that in the clinical you don't diagnose PCOS straight away by just telling the symptoms. By look at the symptoms, you say, "Wow, you have PCOS." Don't do that because you don't know until they had a scan. I want to tell you that over here in your palm, over here, if there is some island things in here, and that normally PCOS or endometriosis. And again, you can't tell whether it is PCOS or endometriosis or fibroid. It's over here. That's why in balanced method acupuncture, we needle here for any pain or any disease in the uterus. So here, if here get some island, like the crease, the palm crease that actually become island, a few of them or just one, and that mean the uterus has some problem. Okay, this is using palm diagnose, okay, to check. All right, what are the most common PCOS symptoms? Now, irregular period is the first one. We know that the cause of the PCOS, the male hormone increase in women, right? The male hormone increase, that means the female hormone decrease. Now, without going with female hormone, the female hormone control your menstruation. Now, and your ovulation. So irregular period means that PCOS patients, they have less period. When I say less period is every month you get your period, right? The cycle will be 28 days, 30 days, or 32 days regularly. But which means if it's 28 days, you get it once a month. But you don't get it once a month. You probably just get 8 times a year. If one a month, you get 12 a year, right? And you get 8 out of 12, or even less, 5 out of 12. I've seen patients just get 1 or 2 out of 12. That's PCOS symptoms. So very common in here. Number 1 is irregular period. Number 2, heavy bleeding. Why would you get heavy bleeding? That's because if you skip for 2 months or 3 months your period, you haven't got your period for 3 months, a uterine lining builds up for a longer period. So, and normally if the uterine lining up to here and it fall, swelling, then you get period. But now it goes that big, that thick, and for a month, and another month, you didn't have a period, it get even thicker, even thicker. That is the amount for 2 or 3 months of the uterine lining. So when you have your period, when period happen, you have to pass out all this. So it causes heavy bleeding. Does that make sense? So the period, the bleeding will be heavier than usual, than normal. Okay, so that is what we call heavy period in PC. Is one of the PCOS symptom, common symptom. Now, hair growth. So more than 70% of women with PCOS, they have excess hair growth. Right. And where is the area? This is because the male hormone increase, right? So you may find that if you suffer from PCOS, the hair grow in here, tummy area, here, tummy area, up to your belly button, or the back, or chest area. Those are the more common area for hair growth. And the next one is acne, the skin. So especially the face skin, yeah. So you get acne. It can be in the back as well, acne, and it also can cause the it's quite oily in your skin. You feel, oh, it's quite oily, right? And the skin can break out easily, right? Break out easily. The next one is gain weight. You put on weight, right? You put on weight. Now, up to 80% of women with PCOS are overweight. Wow, that's a lot, isn't it? That's why we say yesterday when we said about we talked about the cause of PCOS. Women obesity, gain weight, and PCOS have the cause of it is insulin resistance. So with insulin resistance and gain weight, and it actually you put your chance, your risk of the type 2 diabetes is higher than the others. Okay. Then I want to tell you another thing is gain weight, right? When you gain weight in the treatment of PCOS, when we come to treatment, we talk about diet and we talk about exercise, because I've seen people lose weight and those symptoms it's gone. Like irregular period is one of the main thing. Then if you have regular exercise, then what happened is you keep your weight low, you lost weight, and your period may just become normal. Okay, and the one thing that it's difficult to become normal is the hair growth, the hormone things. Okay, but it helped a lot. Okay. The next one is the what do we call male pattern bonus. Okay. Did I say bonus or what? Like you lost a lot here, and you mainly lost here and here. With PCOS, you lost a lot here. Okay. when you lost a lot here, this symptom we talk about is, according to Chinese medicine, is the kidney function, the kidney control here. The kidney function is low, so you lost a lot here. Okay. The other symptom is darkening of the skin. What does it mean? You get dark patches of skin in some of the body. It mainly happen in the body creases. It means that in your neck you get dark patches, yeah, in the crease in here, or in your groin, under your breast. The skin color change, it change to darker, right? Mainly on those area, right? And the others common symptom is headaches. Headaches. Now, because of the hormone change, and that can trigger the headaches. You know, now we talked about migraine before, and women get migraine when they have the period every month, and that's horrible. That's because the hormone change. So, really, what type of hormone change that causing headache? It's hard to say. But one of the hormone changes, male hormone increase, that and the female hormone decrease, then that actually cause headaches. And yes, in PCOS, headache is one of the common symptoms. That's causing for um, that's causing for male hormone increase. Does it make sense? All right. Those are the symptoms: irregular period, heavy bleeding, hair growth, acne, weight gain, loss hair, darkening of the skin, headaches. So 7 common symptoms of PCOS. And those are the common symptoms. But as I mentioned before, if you have PCO, polycystic ovaries, you may not have those symptoms. You may not have those symptoms at all. You may be okay, okay, or you may have all the symptoms, but you don't have PCO. So you can't diagnose with PCOS, right? So PCO and PCOS is 2 different things to diagnose, right? So I want to make it clear because I've seen that a lot of people actually confused about this, and they have those symptoms and or they have cyst, and straight away they put PCOS. I say you don't have symptoms, you just have one thing called PCOS, no PCOS. With the S, without S and with S is a big different things. Okay, a big different things. Okay, this is for today, and thank you for everyone being here and support me and watch this live video. So if you have any question, please put it down there. And remember, if you think that this is valuable and you learn something from this live video, please let me know. And please share this video, live video on your social media. Thank you very much. And as promised, every morning I'm going to keep doing the live video. All right. Stay awesome, and I love you all. See you tomorrow morning. Bye bye.